Why is L-DOPA used to treat Parkinson's? Imagine a city where the traffic lights suddenly stop working, causing chaos on the roads. In Parkinson's disease, the brain's movement control system faces a similar problem because of a shortage of a chemical called dopamine. Dopamine is like a messenger that helps coordinate smooth and controlled movements. When dopamine levels drop, people often experience slowness, stiffness, and tremors. The core issue in Parkinson's disease is the loss of nerve cells in a part of the brain called the substantia nigra. These cells produce dopamine, but as they die off, dopamine levels fall sharply. Since dopamine itself cannot cross the blood-brain barrier, which is like a security gate protecting the brain, it cannot be given directly as a medication. Instead, doctors use a special precursor called levodopa or L-DOPA, which can cross this barrier. Once inside the brain, L-DOPA is converted into dopamine by the remaining nerve cells. This process helps replenish the brain's dopamine supply, restoring some of the normal signaling needed for movement. The increase in dopamine helps reduce symptoms like slowness, rigidity, and shaking, making daily activities easier for many people with Parkinson's. To make this treatment more effective and to minimize side effects, L-DOPA is often given with drugs called peripheral decarboxylase inhibitors, such as carbidopa or benserazide. These inhibitors prevent L-DOPA from converting into dopamine outside the brain, which means more of the medication reaches the brain and fewer side effects like nausea or vomiting occur. L-DOPA is considered the most effective medication for improving motor symptoms in Parkinson's disease. It is usually introduced when symptoms become harder to control with other drugs. Over time, some patients might develop motor fluctuations or involuntary movements called dyskinesias, especially with long-term use. To address this, doctors may adjust doses or use advanced delivery systems to help manage these effects. It's important to remember that while L-DOPA helps control symptoms, it does not stop the disease from progressing. Researchers continue to explore ways to improve treatment and find potential cures, but currently, L-DOPA remains a cornerstone of Parkinson's management. Always consult healthcare professionals for personalized advice, as treatment plans are tailored to each individual's needs and medical history.